Good morning, ladies and gentlemen. It's Istvan Ujhelyi from Budapest. Dear colleagues, dear participants, it is an honor for me to host this morning's very important event called The Role of Intensive Care Medicine in Building a European Health Union. And also a privilege to say the welcoming remarks today. Thank you for the great collaboration with the European Society of Intensive Care Medicine. First of all, I would like to introduce my dear friend and colleague, and if I can say something like this, my partner in crime, Mr. Professor Maurizio Cecconi, who is the president of the European Society of Intensive Care Medicine. He is a professor at Humanitas University in Italy and head of the Anesthesia and Intensive Care Unit at Humanitas Research Hospital in Milan. He was labeled one of 3 pandemic heroes by the Journal of the American Medical Association, alongside the United States Anthony Fauci and Li Wenliang, who died of COVID-19 after being the first doctor to warn about the novel coronavirus in China. He has been, my friend Cecconi, Mr. Cecconi, he has been overseeing the development of the COVID-19 space training program funded by the EU and implemented by the ESICM, for which we will be talking in a while in more details. Professor Cecconi will be our moderator during the event, so welcome, Professor. Happy to work with you again. My name is Istvan Ujhelyi. I'm a member of the European Parliament from Hungary. I'm a vice chair of the Transportation and Tourism Committee, but I'm also a member of the ENVI committee, which is responsible, for example, for the healthcare, the public healthcare. And more than 2 years ago, before my second term and before the COVID-19 pandemic, I have decided to focus on the healthcare. I did it so because of the healthcare system situation in Hungary, and because my parents were doctors, and half of my life was around the Hungarian health structure. You should know that I'm a politician who is deeply committed to improve healthcare in Europe. I was member of the Hungarian government before, and I know very well we have to push this issue now on European level. And please allow me to start with something personal. 2 months ago in May, the ESICM has contacted me to have an online meeting in order to discuss the role of intensive care medicine professionals in the European Health Union. As most of you probably know, that this organization is the leading medical organization in the field of intensive care in Europe, with a global membership reach in more than 120 countries. During our discussion, it was clear to me that the ESICM and its members are committed to build a working European Health Union, which is also my goal. But more than 2.5 years ago, it was only just a dream to have a European Health Union. It was my dream and also my colleagues' dream. Thanks to Sarah Cerdas, for example, and Peter Vitanov, to dream has become reality when the S&D group in the European Parliament, my and our political family, has adopted first among the political groups in the European Parliament the pioneering health strategy position paper called European Health Union. That was in May 2020. Since that time, a lot of things has happened, but we are not done. We have plenty of things to do. The epidemic has highlighted the need for EU resilience, the medicines shortages in Europe, and the EU's dependence on outside countries for production of many pharmaceutical ingredients and medicines. Besides, the COVID-19 outbreak has accelerated the debate about supply chains, which are vulnerable in Europe. We have reached important milestones like the EU for Health program, which is a huge success because nobody thought that This program will get 5.11 billion euros to strengthen the resilience of health systems. But it's happened. And Sara Cerdas was the SND shadow reporter, and I hope she will be together with us today. We should focus on a very important thing, to protect the health of all European citizens with high quality care. Despite, as I said earlier, we took the first steps. We still need more coordination in the EU, more resilient health systems, and better preparation for future crises. But on the other hand, strong European national health systems are crucial to reach our goal. These can be achieved through private and public investments. Investments are needed for a quick digital transformation of healthcare with digital infrastructure. Besides digitalization, coordinated and collaborative cross-border action in the European Union is also necessary. We need to stimulate and support research and development, public, private, and public partnerships, cross-border initiation, innovative SMEs, medical education, and we should give some flexibility concerning the regulation. We need better cross-border training programs, cooperation, and we need collaboration and solidarity between the EU institutions and the national and regional governments. The query of the healthcare system is a member state competence, we know very well. But the COVID-19 pandemic has raised new questions about competencies in health policy. The conference on the future of Europe is a unique opportunity to discuss these competencies, and we can see the political willingness regarding this. The pandemic has shown the importance of the work of intensive care medicine professionals and has highlighted the numerous challenges they are facing. The past year has posed new and extreme challenges into intensive care units across Europe. The restrictions of the free movement of intensivists across different member states, especially in times of pandemic and cross-border health threats, puts intensive care medicine at a significant disadvantage. Frontline healthcare professionals need further support from European leaders, addressing the shortage of resources in the European intensive care units, investing in our human capital, increasing the number of specialists, doctors, nurses. The training for European healthcare professionals is crucial and should be further covered by EU programs and actions. Create cross-border cooperation for intensive care units specialists and share capacity during crisis. And removing all bureaucratic barriers to the free movement of intensivists across the EU to allow exchange of knowledge to contribute to raising the standards of care. And of course, to build together the European Health Union. Health is not everything, but without health, everything is nothing, said by German philosopher Arthur Schopenhauer. His thoughts are very timely because we have now the momentum in order to reach our common goal, which is a well-functioning European Health Union. At the end of my speech, I would like to say thank you to Marina Antonova, who worked tirelessly to ensure the success of this event. Thank you again for the opportunity, and we're going to continue our work. And of course, thank you Zoltán Panca, who is my excellent advisor and colleague, who is responsible for the ENVI committee, who tried to push me and push all the political issues to support the European health issues. A very important technical detail from now on, the chat is open and participants can post questions during the debate. These questions will be answered at the end of the debate, but before the closing remarks. So please send us your questions. We really hope that there will be a very active Q&A session at the end of the event. And now I will pass the floor to Milan, from Budapest, to Maurizio Cecconi, professor. By the way, congratulations. Yesterday evening was very, very, very exciting. Congratulations to the Italian team. So, Mr. Professor Cecconi, the floor is yours.
Istvan, thank you very much for hosting this important webinar. Thank you for your kind words, and really thank you for trying to raise the awareness of the issues about the free movement of intensive care professionals in Europe, really, and to start this debate today. Today we will talk about the role of intensive care medicine in building a European Health Union. I would like to thank all the speakers that have agreed to be with us today. We have members of the European Parliament, we have a guest from the European Commission, we have a young intensivist from our society. You will be able to interact with us, with the different panels, by asking questions that we will try to answer. But let me start by saying one thing. For intensive care units around the globe, this has been probably the most important challenge we've ever faced in our lives. A very difficult situation, but also a situation that makes me very proud to be part of this community. And when I think about what happened in the last 15 months, during a crisis, you have to stick to your values to find direction. And I think there was one key value in this, which has been solidarity. Solidarity among healthcare workers, solidarity in hospitals, but also solidarity with institutions. I will talk a little bit more about what we've done with the European institutions, which I think is being an extraordinary training program, and we will show you some data later. But it also showed the importance of solidarity also with the citizens. Citizens have really been the ones that had allowed to put the pandemic under control, adhering to the restrictive measures when necessary, now adhering to the vaccination campaign. And that's an extraordinary help for us in intensive care, because by dealing with a reasonable number of infections, we can really do better care for all patients that need intensive care. So as a society, we have been very active from the very first days of the outbreak in Europe. I happen to be at the center of the first outbreak outside of China. And since the very beginning, together with the former president, Joseph Keseshoglu, and all the executive committee of our society, and every member really, we decided from day one that we wanted to do something for the global clinical community. During those days, there were still many fake news coming out, a lot of confusion. There were still some people claiming that this could have been just a flu. It was difficult for clinicians to understand what was going to happen if the outbreak was not already there. So our mission was to stick to the value of solidarity, to stick to the values of sharing knowledge, and we decided to become a hub to share knowledge with everyone, members, but also non-members. So we put all our forces from the office, from our membership, from our experts, and started to organize free events for everyone. Just to name some of the milestones of last year, on the 28th of March, we organized a marathon with clinicians from all over the world. We had more than 160,000 participants worldwide. We started from that moment to hold the weekly webinars. And again, we still do that, and we do more than 2 live events a week. Again, with the final aim to share free knowledge, to share something that can be useful to treat better our patients at the bedside. We use the social media. We've been very active, and we've reached millions of impressions, for instance, on some of the metrics of our social media channels. But one thing that makes me very proud and very honored of having been part of this, and I'm sure I will remember these for many years to come. Probably these will be some of the stories that I will tell my kids when they are grown up, was the collaboration that we had with the European Commission. The European Commission, I have to say, impressed me for how active it was from the very beginning trying to put together clinician networks, again, with the aim to share knowledge and to understand how to deal with this pandemic worldwide. And we reached out to them, but they reached out to us. So we found each other, and we started to bring the information that we could bring from our membership. At the beginning, the conversations were around which medical devices would you need if there is a second wave? And unfortunately, we knew that there was a second wave. These conversations were very important. It was an attempt to be better prepared compared to what happened. And I think we have to be honest, the whole world was not prepared for this pandemic. But in that moment, we had an opportunity to take some actions to be better prepared for the second and third wave, which unfortunately occurred. The conversation went from medical devices and drugs, but at the same time, we immediately say that one of the biggest shortages and one of the main issues was the fact that it would have been impossible to train specialists in intensive care just in a few weeks or months. It takes years to become an intensivist. It takes years to become a specialist nurse in intensive care. But we shared also the experience that during an outbreak, in order to cope with the surge in beds, what happened is that some activities, some other clinical activities are stopped, and healthcare workers not working regularly in intensive care are deployed to intensive care units. These people come with great enthusiasm, but they may not have the basic skills to help ICU teams. This is stressful for these healthcare workers, is also not optimal for the ICU teams. So we thought we really need to put focus on people now. As always, when you focus on people, you get the best results. This was the kind of the background for an idea that we had together, which was the C19 space training program. This program has been funded by the EU, and the European Society of Intensive Care Medicine has organized and delivered the training. I have a short video which speaks more than my words, which I would like to share with you now to tell you a little bit more about this program, and then I will show you what we have achieved in the last few months.
We cannot be unprepared twice.
Prevention does not begin at the gate of intensive care, but at the community. That's why we need all your help.
We need a healthcare army. Welcome to this immersive learning experience of C19 Space.
Following this program, we'll really help them to get an idea of what working in an ICU is like and to really be immersed in the basics of learning ICU skills.
Basic training so that people get accompanied or accustomed to how an ICU looks like, what is expected from them, ICU staff around, and there will always be ICU staff around to support you when you call for help.
This goes into much more detail and provides key learning objectives and also some assessment to test knowledge. That hasn't been easy to do during the COVID period. Pulling together different individuals from different countries, all with a common aim. So I think that's been very valuable.
Exciting, innovative and portable.
It's incredibly positive, coming in at the right time, and if we can use it and build on it, it's fantastic.
It's very innovative and interesting to do it. So let's do it.
Training program, that video still give me many memories because from the moment we agreed to go ahead with this training program, it took about 3 weeks in which 70 experts from all over Europe, they put together their energy and efforts, and we worked basically 24/7 to deliver this, and we were ready to go basically just in a month with this training program, which is tailored to doctors and nurses with some common pathways and with some specific pathways for the two different professions. Our goal initially was to reach 10,000 healthcare workers not working regularly in intensive care in Europe. The program was a great success. There was a very high interest, and it really answered a need in our community. Our teams were tired, they didn't have the time to get trainings like this in place locally many times. And so I'm very pleased to share some of the numbers. We had more than 17,000 trainees, 17,494 trainees among physicians and nurses, 2,600 active trainers. These were ICU team workers that decided to use this toolkit to teach and to train basic skills so that they could have better teams when these EU resources were deployed. There was very positive feedback. It was a great moment again of solidarity, and people were expressing their gratitude, and we received a lot of thank you letters and so on. Importantly, we were able to test the knowledge pre and post the training, and we were able to show that there was a significantly increasing knowledge, which means more skills and probably also more comfort in these healthcare workers in joining the ICUs when needed. I cannot express enough the gratitude that we have as a society for the European Commission for the support to the frontline healthcare workers across the EU, really to help us to implement this essential medical training. I'm just going to show you some pictures that we received. We also use some very innovative tools like immersive virtual reality. We did this because we knew that it was difficult sometimes to spend some days in the intensive care units locally to get to see some procedures. Procedures may occur at 3 o'clock at night, but maybe you're coming for the training at 8 o'clock. This allowed us to film a very realistic situation with actors that were ICU nurses, doctors. I can guarantee you it's probably the most vivid experience about procedures in the ICU that I've ever seen. And really we got feedback from all over Europe. I'm just showing you some of the smiles behind the masks here. And with this, I am concluding my presentation. And since my presentation is being focused on the C19 space training program, I would like to introduce now the next speaker, Isabel De La Mata. Isabel De La Mata, she is the Principal Advisor for Health and Crisis Management at the European Commission, DG Santé. Previously, Isabel was a health counselor at the Permanent Representation of Spain to the EU, Deputy Director General of Health Planning at the Ministry of Health, and among many things, also a consultant for the WHO. But for me personally, Isabel has been the key person in the European Commission, listening to us, believing in this training program for the very beginning, giving us the courage to go ahead, and really a very, very important person, which again, we all are very fond here in the European Society of Intensive Care Medicine. And really, we would have not been able to organize and to deliver the C19 space training program without Isabel and her team. And so with this, I would like to welcome Isabel and to pass the stage to you. Hello, Isabel.
Hello, good morning, Mauricio. Really, it has been a pleasure for us to collaborate with the society in having this training. I mean, and to learn to know the society, that I have to confess that I didn't know all the activities that you were doing and how brilliant you were doing the activities. So one of the main instruments that the European Commission, the European Union has been using in fighting the pandemic has been the emergency support instrument. The emergency support instrument, that is a new instrument that is based in the solidarity of the member states and to pool the efforts and the resources to quickly address the shared needs that arouse. So this instrument was first established in 2016 when the European Union was confronted to what so-called at that moment the crisis of migrants and refugees. and was revitalized again in April 2020 to respond to the COVID-19 pandemic. And this instrument that is you have here for sure, the one with whom we have been doing the advanced purchase agreements for the vaccines, or paying for the transport of patients, health professionals, or cargo from one country to the other, or paying for cleaning robots, disinfection robots, or tests, etc., is what they allow us to finance and to put in place this program of training of health professionals. I have to say that previously we have the contact with the European Society of Intensive Care Medicine when we established the network of clinical management. We were used to work with the health professionals in the European Reference Network, and that is established mainly for rare diseases, and to put together professionals to discuss cases. And at this moment, when we were in March, April 2020, at the beginning of the pandemic, that we didn't know how to deal with the virus, how to treat the patient, what to do with the patients that were arriving in the hospitals. We thought, and with the collaboration of the society, of course, that they have this idea that could be good to establish these networks where professionals could put in contact themselves live, or just through the secure mechanisms that the network allowed, to discuss the cases and to establish the new ways of treating the patients that were arriving to the intensive care units in a huge number, and we didn't have the means and we didn't have the knowledge for that. Then one of the things that we discussed with the society and that we realized is that there were not enough health professionals, so that were working, but was very difficult to, from the night to the morning, to establish, to train new professionals, to contract new professionals that could assist in the intensive care unit. So we were thinking of this training of health professionals, and I remember that at the beginning they were very modest and they wanted just to do an online training modules that they will put in the website, and that will be a small investment. And when we requested, we said, why we cannot go further and go bigger and do a real training of a lot of professionals in the European Union, combining online training with live training and etc. They were at the beginning a little bit surprised and shocked of the challenge, because it was a challenge of managing a lot of professionals that at the end had been 17,000, more than 17,000 trained, and more than 2,000 trainers in 700 hospitals all around the European Union and the United Kingdom. So they responded to this challenge, and now we have a lot of professionals trained. They could be engaged when needed by the national health services in the countries, and this has been so successful that now we have requests from outside the European Union to continue with the training, to do the training in other countries. So this is also paving the way for other professions, other healthcare professionals on other specialties that could do the same. And for example, in the work program of the EU for Health of this year, there is already the intention for cancer, that is one of the priorities, to do an inter-specialties training also around the European Union that could take the example of what has been done in intensive care medicine, and in next years we could continue like that, and doing what at the time we call Erasmus for healthcare professionals, but also how to do this continuing medical education, but also this intersectional training, because sometimes you make the planning of healthcare professionals today, but for needs that you will have in 10 years, and in 10 years the needs happen that will be different, and you need to do quick adaptation. So we have the example that this is possible, and we are really very grateful to the Society of Intensive Care Medicine, the C19 space has been a real success. We are very happy. I think that not only the health professionals, but the European Union citizens are happy that you have done this and that we have achieved this big number of professionals trained and this big achievement of the healthcare services being more responded, more resilient, and that we need to continue like that. So thank you very much for that, and thank you very much for you that are listening to this, and please communicate, defend this achievement and that these good activities that have been done by the European Society of Intensive Care Medicine. Thank you very much.
Thank you, Isabel. Really, thank you again for all the collaboration with your team. It's been working together and made the success possible. Isabel is going to stay with us also for another panel at the end, so we will also have time to ask questions later about some of the work of the Commission in this sense. And now it's time to move to the next panel. And I am very happy to introduce the first panel, which is Recovery After the COVID-19 Pandemic, a vision for the European Health Union and the future of Europe. We have three speakers, members of the European Parliament. I'm going to introduce now the first one and give the stage to Ms. Sirpa Pietikainen. Sirpa Pietikainen is an active MEP in health policy with long-standing experience from the European Parliament since 2008, and she's been working in strengthening the European cooperation on health. Sirpa served as a Finnish Minister of Environment and had an extensive career at the Finnish Parliament. Within the European Parliament, Sirpa is a member of the Committees of Environment, Public Health and Food Safety Committee, ENVI. She's an active advocate for patients' rights and serves as a chair for the Finnish Association for Mental Health, and is a member also several health-focused parliamentary interest groups. Sirpa is also a member of the Economic and Monetary Affairs Committee, Special Committee on Tax Ruling, as well as of the Women's Rights and Gender Equality Committee. So welcome with us, Sirpa.
Thank you. And first of all, thank you all for organizing this event. I'm more than happy to be part of this debate, and I hope a longer process for working for even better intensive care in European level. I think that we all can agree that nothing is more vital in a minute than the intensive care from the patient's perspective. And I think that we all can agree that be it doctor or a nurse, this is extremely demanding special expertise among the different expertises of medicine, not trying to minimize the importance of the others, of course. We know two other issues about intensive care. One is what was already discussed here, that we can have pandemics like the COVID-19, when suddenly all over the Europe and all over the planet, the resources for intensive care are stretched, and we do need to have more capacities. And that's why I'm very happy to see the education initiative, what you have been taking. And I think that this is something that should be financed and supported by the European Union to have this kind of upgradability capacity in crisis situations. But then again, there are two or three other aspects. One is the differing competence demands in different member states. And we have to remember that there are different kinds of a crisis that can be pan-European. You could have a crisis in Italy, or we could have a crisis in Finland, where that sort of a stretches beyond our capacities of doctors, while on the other countries and other parts of the Europe, there isn't such a crisis. And then it would make a lot of sense that this very specialized unit and capacity could be more flexibly used in different parts of the Europe when the crisis is as such that it can be dealt safely, of lending the capacities to some other member states. And I guess this was case with the COVID-19 as well, in some times where the urgency was greater in some other parts of the Europe than on the other parts. So better harmonized competencies, better support for education, and better flexibility on using this specialized workforce in crisis situation. But I think that with this EU for Health and the Health Union that our speaker was telling about in opening the seminar is a good way to upgrade the whole role of intensive care in Europe. We do have a special programs on diabetes, on cardiovascular diseases, asthmas, or mental health, as is a proper thing to act. Should we have a pan-European program of intensive care of the bits and pieces? We do not have time, and at least I do not have the competence to discuss in detail right now. Second point is that, as you well know, because that is so demanding, that we do have a rather extensive network that is growing and improving of reference centers on rare and extremely rare diseases. Wouldn't it make a sense to have a reference center on developing the area and sharing the knowledge, and maybe sometimes lending the competencies in special case online or offline to some other parts of the Europe, on intensive care as well? At least to me, that would make a lot of sense. And all in all, in this, I hope that we in European Parliament could establish a permanent group about intensive care, and to learn ourselves as politicians more and better about the possibilities and challenges of intensive care, and to try to create, with the help of you, the specialists, this kind of a European, pan-European program of intensive care, what it needs. And that, of course, goes beyond the personnel, about the medicine, the equipment, or be it whatever part is needed. And then together, and with your help and expertise, this could be pushed forward so that we could have, by the European Commission, a own initiative to have a special program and a reference center for the intensive care. This is what I have to say at this point, and as said, extremely happy and proud to be part of this process, and I'll do what I can to support this initiative and your very valuable life-saving work. Thank you.
Thank you very much, Sirpa, for your very insightful comments and speech. And we will have time for some questions together with the three members of the European Parliament. So it's a pleasure now to introduce the second speaker of this panel, Sara Cerdas. Sara is a Portuguese medical doctor and since 2019 a member of the European Parliament. Within the European Parliament, Sara is a vice chair of the Special Committee on Beating Cancer and co-chair of the European Parliament Working Group on Health, which brings to discussion European health issues with different stakeholders and experts. Sara is a member of the Committee on the Environment, Public Health and Food and Safety, ENVI, and the Committee on Transport and Tourism. Hello, Sarah, and thank you for being with us today.
Good morning, Mauricio, and thank you very much for inviting me to be here. It's quite an honor. And I would like to give a special thanks to the European Society of Intensive Care Medicine. Just to check, can you hear me and see me all right?
We can hear you and see you very well.
That's great. So it's for me quite an honor to be here. I'm a shadow rapporteur. I was a shadow rapporteur for the EU for Health file and currently for the cross-border health threats file. So I'm going to discuss a few of the points I would like to see developing at the EU level and that are quite related to intensive care. So we understand that this pandemic unveiled some of the main chronic issues on healthcare provision, and also that we need to have more European Union in health. It's important to disclose that according to the European treaties, the provision of health care is a competence of the member states. It's not from the EU. However, the protection of public health is a shared competence between countries and the European Union. And this is where we aim and target to work. As already been said today, this morning, COVID-19 showed the true resilience of healthcare and its core, the health professionals. You were one of the biggest players in this very, very long marathon of this fight against COVID-19. And you worked tirelessly to keep ICUs open and fully working, which was essential to have a good outcome out of this crisis. I would like to I would like to use this opportunity to thank all of you for your very much heroic effort and for your professionality and effort and personal efforts are quite priceless. One of the biggest concerns we had at the beginning of the pandemic was, as you all remember, the lack of medical devices, individual protective equipment, medicines, other medical products in order to give a proper response to the health crisis. So what happened? The EU and the member states went to the market to buy these products. And some of these products were used in the ICUs, as we know, it was one of the characteristics of this virus is that sends the moderate and severe cases to ICUs, and that's the last shot anyone has in surviving. But there was also a lot of donations of equipments, even from private sectors. But the trouble here, and what we need to acknowledge, is that ventilators do not work alone. It's like an airplane. You can give a lot of airplanes to a lot of people, but only a few know how to handle it and how to pilot it. It's the same with ventilators. And as it was said again by Mauricio at the beginning, the expertise and the knowledge how to operate ventilators, how to work in the ICU takes a lot of time and takes a lot of resources. One of the main problems that we have at the moment at the EU and needs to be acknowledged is the lack of mutual recognition of ICU professionals' competence across EU member states. For this, we aim to create and we need to create a framework for the recognition of intensive care qualifications in the whole of European Union and remove all bureaucratic barriers to allow for the free movement of intensivists across the EU in order to allow the exchange of knowledge, good practices, and contribute to the improve and raising the standards of care. I would like to share what we already have said, and the Commission already had referred this. In the EU for Health program, we asked for more training of healthcare professionals, especially in health crises, and this has already been done. And in the report on serious cross-border threats to health, we aim to reinforce the training of healthcare staff and specialized treatment and intensive care across neighboring regions. In this file, we will also promote the involvement of health professionals on the discussion of prevention, preparedness, and response plan. What does this mean? We want to include health professionals in all the scale of planification in order to be prepared for future crises. Frontline healthcare workers also need to support for European unions, and one of the main questions is how can the EU guarantee the adequate resources in large scale for crisis time in order for us to have sustainable future and matching the health needs of an aging and more aging population. Meaning we need to understand and ensure the resilience of our systems, not only in crisis time, but also in normal times. For this, we need to invest in our human capital, increase the number of specialists and recognize that specialty, as I already mentioned. And another big point that has been done by our society during this pandemic, which is the training of healthcare professionals, that it's crucial and should be further covered by more EU programs and actions. For this, we at the EU aim for the creation of a true cross-border cooperation for intensive care specialists and sharing this capacity during crisis, meaning future pandemics, because this is not for sure the last pandemic we're going to see, and mass casualties among many other crises. Just to finalize, we're now in the momentum to reinforce our healthcare systems. And for this, we need to work with all the different stakeholders. And for this, also, we need to involve the health professionals in the discussion. And only with this involvement is that we can aim for success. Thank you very much again for the opportunity to speaking here. And I wish you all the best in your endeavors to further the intensive care practice in the EU.
Sarah, thank you very much for your contribution and for your words. Sarah is going to stay with us for the questions to the panel at the end. So it's a great pleasure to introduce, last but not least, our next speaker. Mr. Peter Vitanov from Bulgaria is a member of the European Parliament since 2019 and who is being advocating for strengthening of public health competencies at the EU level. Peter has been active in Bulgarian politics for 10 years. He is currently a member of the Committee on Transport and Tourism and the Committee on the Environment, Public Health and Food and Safety, and a substitute member of the Committee of Civil Liberties, Justice and Home Affairs. Peter, thank you very much for being with us today.
Thank you, Professor. I hope you can hear me well because the connection is not very good in this remote city of Bulgaria. First, allow me also to thank you because it is a great honor that you choose me, myself, some of my colleagues for your partners. I was honestly extremely impressed when I first had the opportunity to meet you personally and your association. I think there is one good thing about this pandemic, that it shows the main challenges of the intensive care medicine. It put them on the spotlight. Now, of course, everybody that is personally affected realized how important your job is. But now I think that the whole European, and not only European, but the global population realized that this is one of the most key important sectors in the healthcare. So everybody now, at least in the European Union and in the European Parliament, we try to figure out what the main challenges for the intensive care medicine community in Europe are. Some of them were already mentioned by my colleagues, but what is the most important? To me, of course, this is the barriers to the free movement of intensivists. And here we are creating some kind of paradox, because the system allows moving critical EU patients across the EU countries to search for the best possible treatment. But still at the same time, we do not have the flexible enough systems to recognize the the qualification of intensivists in the European level and allow them to move freely, of course, to cure sick patients in another country. And this, the moving of critically ill patients is not the best possible practice because of many reasons. On one hand, because you are creating additional risk for the health of the patients, but on the other hand, it creates additional trauma to his or her relatives. ICM is not recognized as a medical specialty across several member states, and this creates serious challenges for the free movement of specialists to move freely within the European Union, and integrating ICM in the Annex 5 of the Directive of Recognition. It was already mentioned by most of my colleagues, and not only by my colleagues, of the professional qualifications should be, definitely, no doubt about it, underlined at the forefront of the future health union debate. And I believe, all agree on that. And I understand that member states and governments are particularly careful when we talk about such a sensitive topic as qualifications and medical stuff. But there is one we learned during this crisis, and this is that we are in this together. When things get tough, when things get difficult, we definitely rely on each other. Of course, it might not have been perfect. We saw some bad examples of selfish behavior, but we also saw the amazing examples of member states helping each other, transporting patients, sharing knowledge, not just an equipment. Another challenge, of course, we also found that we do not have enough medical personnel across the European Union. So we have to not only talk about how to move medical doctors from one country to another, but also how to improve the overall availability of medical personnel. Another challenge, it was underlined by my colleagues as well, the missing resources of intensive care units. Now, the pandemic increased the pressure of intensive care units in terms of human resources available. When new intensive care beds are opened, additional resources need to be relocated, which means that some of you guys have to stop doing your other activities. And ICUs are first and foremost skilled people with the life-saving competences. Material resources are definitely important and crucial, but the policy, and it was shown the last year, the policy of reduction of intensive care units that is being performed by some of the member state countries should be reconsidered. That's what we saw about these pandemics, because the policy of austerity, and I'm saying this not only as a socialist, but as a citizen, the policy of austerity in healthcare is completely unacceptable, because nothing is more important than a human life, and healthcare is one of those sectors and one of those areas where you simply cannot leave it to the free market. Now, another challenge, and it hasn't been mentioned so far, this is the moral injury of those who work in the intensive care units. Because due to the lack of resources, we all remember what happened in Italy, and you know best. You know best because you were there in the beginning of the pandemic. Many healthcare workers who have developed a feeling of guilt or helplessness because they know that they could not provide the necessary level of care which they do in normal circumstances, and it created a deep psychological trauma for them. Also, the psychological pressure of the intensive care unit staff. Healthcare workers in ICU are under increasing pressure during the COVID pandemics, and I noticed that survey because of concerning the burnouts. Yes, the burnouts existed before, but have become really more prevalent. And from a psychological point of view, these people, your colleagues, have suffered the equivalence of the battlefield, the equivalence of the soldier at the battlefield. All these issues and all these challenges, they are interlinked together, and they need to be considered by decision makers. If we want to build a robust and European Health Union, it was mentioned, and it was in the bottom of the presentation of Isabel, the training, investing more in training as a better response for every health threat, because Sarah mentioned this is not going to be the only pandemics we are going to suffer. In times of pandemics and in some other situation, we need an urgent and efficient response. We need clear policies to invest in, and most critical factor to save lives, human resources. We cannot expect to train experienced intensivists for weeks, because necessary skills are obtained. They need years to obtain, of course. Also the digital developments and skills, digitalization of health sector and the data usage, better understanding of the diseases, analysis of the results. These are all very important issues. Investing in training and research programs in the field of health data will give an important push to the advancement of sciences to the benefits of all. And finally, common problems require common solutions. The skill and knowledge of ICM specialists should be mutually recognized between the member states. Only then can we hope to have a common European healthcare emergency workforce ready to be mobilized and dislocated across the European countries. Definitely more, and it was underlined also by my colleagues, more coordination is needed between the member states. Pandemics are transnational problems which cannot have national solutions. They require common solutions. More coordination is needed in the way that we approach these pandemics. For example, the vaccination strategies, for instance. The lack of good communication and mutual understanding between the European countries is a serious threat before a fully functional European Health Union. Such is the nature of these contagious diseases. That is, it is absolutely impossible to take care of ourselves. This goes for people, but also for countries. Even Australia, I had the opportunity to meet the Australian ambassador in Greece and Bulgaria here. This is an isolated country. They managed to save, they managed to shield their population, but now they're facing the challenges because they have to reopen their borders. And no country can stay isolated forever, not even North Korea. So we need cooperation, we need coordination, we need understanding, we need empathy between people, between countries, and most particularly in the European Union, between the member states. Thank you, Maurizio, for this opportunity, for this platform that we can share all our view when it comes to intensive care medicine. Thank you so much.
Thank you, Peter. Thank you very much. I'll ask Peter to stay there, and I would like to welcome back on stage also Sirpa and Sarah. Let me first summarize also some of the comments that I get from our community. Thank you all for the important words that you shared, and also for taking these as one of your goals, because we have seen from your words, we've heard from your words that you really understand the issue, and that we count on your support to try to be better prepared for the future. And indeed, we have probably a few minutes for maybe one or two questions. If I can summarize what I get from our community here is that the world was not prepared for this pandemic. We've realized that the issue of sharing knowledge of the free movement of intensivists is something that probably could be important to sort out before the next pandemic. What are the next steps? I don't know if maybe Sirpa, if you want to start.
Well, as a next steps, on my opinion, it's always hard to push one sort of a single slice, like, you know, the change in interoperability of the competencies only. And what would be my choice is to push this intensive care program, what I mentioned, and you are the specialist to put the bits and pieces there. And it would be very good time to do it now when we have this health union starting on, and when we have in fresh memory, unfortunately, the lessons learned from the COVID-19. And then, of course, on top of that list, what to do, because that would need to be in priority order, would be the training competencies and the flexibility of the workforce, be it nurses or doctors. And
Very
then, of
good.
course, I think that we are all happy, the 3, 4, or even the more numbers of us to pass the message in European Parliament, and maybe this is something what we might consider a bit later on as own initiative report in ENVI, for example, because what we need is more knowledge about the topic, both in Commission and in the Parliament.
Thank you, Sirpa. Very clear. Sarah, do you want also to make a comment?
Yeah, just a very small remark is that, of course, we were not ready for this pandemic, but we had many alerts, mainly from the WHO. And I think we should look at this pandemic and query, learn the lessons that it provided us. And I don't think that we can return to what it was before the pandemic in regards of having more health, more EU health. And this is what we're working on. And now we need to build from that onwards in order to improve our preparedness for future health crises, being from communicable diseases or non-communicable diseases. So this is something that we learned, and we're working very hard to have it ready as soon as possible.
Very clear. Thank you, Sarah. Peter.
Just a short comment now. And here I speak as a Bulgarian, because in my own country, we did not pay enough attention to the healthcare system in general. So we, of course, I'm promoting the document of our political party, our political family. What it needs to be done, of course, strong, robust, new health European Union, but setting a minimum common standards in each and every European country is a must. For instance, the number of hospitals, the number of beds per capita, the number of intensive units per capita. This is something really, really important, and we will work really hard in order to achieve it, because we saw how important the healthcare is, and there were some countries, including mine, where the healthcare became not a right, but a service. And this cannot go that way. This cannot go that way. So this is beyond the free market, and we need to set a minimum common standards for each country. Thank you.
Thank you very much. I am really happy to hear this word, because we have hope that there will be some actions to be better prepared and more united, I think, for future challenges in Europe. And I think this is something that I say as a healthcare professional, but also as a citizen. And I think citizens deserve to have this unity for healthcare in Europe. And certainly you will also have our support if this is what you want to create. So I would like to thank you, and then to move to the next panel, which is our last panel to the day. So thank you very much for your contribution, and I'm sure that we will be seeing each other soon. So our last panel is a panel about enhancing the EU preparedness to respond to future cross-border health threats. And we have the pleasure to have again with us Isabel De La Mata, who is going to give the first presentation. So Isabel, welcome back, and the stage is yours.
Thank you very much. I'm trying to share my screen. Yeah, I think that, yeah, it's okay. So the activity of the European Union in health is defined by the Treaty of Functioning of the European Union, and the article that treats about public health clearly says that one of the objectives is to fight against the major pandemic, the major health threats. So we have a legal basis to act. This is clear. Last year, during the State of Union, the President von der Leyen, President of the European Commission, already said that for me it's crystal clear that we need to build a stronger European health union. And like that, I mean, this came after several months of fighting with the pandemic, where, you know, at the beginning, there were some issues with the coordination. I mean, we were not so well prepared as we had wished. But nevertheless, I think that we responded quite well to the pandemic. But that was, in general, the citizens and the member state felt that we needed to reinforce the preparedness and the response to this kind of crisis. And this is what we are doing now. So during the response to the pandemic, the objectives were to coordinate the response, to reinforce the public health systems, also to take into account the different impact that the pandemic had, not only in health, but also in the economy, in the social aspect, in employment, everything, and coordinate the responses from the member state, and also how to control the surveillance, epidemiological surveillance, and the different informations around the diseases. So all that issues, what the treaty allow us, what the president expressed, and the objectives of the pandemic came with what in November was presented as the European Health Union, and several proposals that are now being discussed in the Parliament and in the Council, so in the co-legislature. So we established what we needed at that moment and what we are proposing. So what we needed, the ones that were identified were that we need a better coordination and better EU intervention. We also needed more information, more data, better testing and contact training, and better preparedness, and also to ensure the supplies of medicine and protective equipment. That was something that was missing during many weeks and many months during the pandemic, because we discovered, unfortunately, that many of the supply of medicines and protective equipment came from outside the European Union, so for third countries. And in this situation, not only because of the travel and the cargo and etc. was decreasing at that moment, but also because many countries were very protective for their medicines and protective equipment, and there were some exportation delays and exportation cancellations. So we needed to work on all those 5 areas, and we were proposing response to all those 5 areas. So on the 11th November, we present the package, what we call the package of the proposal for a European Health Union, with the main objective of strengthening the health security framework and reinforce the preparedness and response to the crisis, and especially the role of the European Union agencies that are the ECDC, the European Centre for Disease Prevention and Control, and the European Medicines Agency, the EMA. So 3 proposals for regulation for serious cross-border health threats, to extend the mandate of the ECDC and extend the mandate to the EMA. This is important because now currently the response to the serious cross-border threats to health is regulated by a Commission decision. In the level of the legislation of the European Union, the Commission decision is in the bottom, and a regulation is in the top. So we are going from a Commission decision that is important, but I mean a law regulating the activities, the action of the European Union in cross-border health threats, that is, I mean, mainly for coordinated, but in I could say in a spirit of goodwill, to a regulation that also keeps this goodwill, but reinforce some of the measures and put more legal obligation and also more legal value on some of the tools and instruments like the Health Security Committee. So in the regulation of serious cross-border threats to health, we are planning from preparedness and response planning. So an EU plan, framework for reporting and auditing in preparedness, regular tests and exercises, targeted training again, so it's very important, and joint procurement. We also have proposals on the epidemiological surveillance and establishing new networks, and also reinforcing the access of ECDC to health data for epidemiological aspects. So to be able to respond, we cannot respond if we don't have the information. Also to reinforce the system that we already have for early warning and risk assessment, so the EWRS, early warning response system, with the new risk assessment also for all hazards, not only biological, so infectious diseases, but also other hazards, and coordinated response at EU level. So the possibility also for the European Union recognition of an emergency situation, that the advice on the response measures. So we reinforce the role of the Health Security Committee, and there will be supported by an independent advisory committee. At the same time, we presented this proposal for the ECDC, expanding the mandate. I used to say that if for the ECDC the mandate was concentrated in a nucleus, now we are expanding like in a ball. So in all the areas we are expanding the mandate, while for the EMA, the European Medicines Agency, what we are doing is a lateral expansion. So having more mandate in some of the areas where the EMA does not have at this moment. So for the ECDC, there are already mandates for the networking, the information exchange, for the data sets, for the early warning and response mechanisms, for the cooperation with the member state experts. But we are expanding that to have more competencies, but in that same area. So the ECDC now could, I mean, when the proposal is approved, could recommend measures for the outbreak control. Also to expand the epidemiological surveillance, to give concrete recommendations for response. You maybe are aware some of the ECDC is working exhaustively without stop and preparing all the report that they are doing, but sometimes we could feel that the recommendations are not so strong because they don't have the mandate to say to the member state, you have to do that, that, and that. Say, well, could be advisable within, according to the scientific knowledge, etc. But this is some of the things that we would like to change, that the ECDC will be able to say, to give the recommendation that will be needed for the responses, and also to increase, modernize the response mechanism, and also to create, this is new, the network of reference laboratories for new pathogens and etc. For the EMA, the main change, I mean, this lateral expansion, is that not only the EMA will be in charge of monitoring the safety of medicines, but also the shortages of medicines, and not only to monitor, but mitigate the shortages of medicines, and also, and this is important, for medical devices. And for now, what they are doing is evaluating evaluation of the safety of medicines, but that will expand also for studies on the effectiveness and safety of the vaccine, also coordinating the clinical trials, and also to offering advice on medical devices and medicines. So it's taking medical devices and it's taking the monitoring and the mitigation of shortages in order that doesn't happen like 1 year ago when we discovered that we didn't have masks, we didn't have ventilators, we didn't have paracetamol, so that they could act in this area. These three proposals are being discussed in the Council and in the Parliament. They are one's more advanced than the others, but the aim is that at the end of the year will be approved and will be enforced, so that we could really have a stronger legislation, and that could allow us to move through a real EU health union. The other instrument that will allow us to progress through the European Health Union is the program, the EU for Health program that was approved in March and was approved in June, the annual work program 2021. This program is not the first one. I mean, we had previously 3 health programs, but this is really fundamentally different. And one of the main differences is that while the third health program that was for 7 years had a budget of 460 euros, this EU for Health program nearly has this budget just for 1 year. It's 360, but for the 7 years is 5.1 billion euros. So it's a substantial increase. The objectives are, well, improving the health union, so it's mentioning protecting the citizens from serious cross-border health threats, improving the availability, accessibility, affordability of medicinal products and medical devices, and strengthening the health system that suffered during the pandemic. So the really is going to be concentrated, at least at the beginning, in fighting still the COVID-19 pandemic, with the cross-border health threats. And you know that we are also discussing the HERA, the new agency, and at this moment, until it will be approved, there is the HERA incubator. The Europe Beating Cancer Action Plan is one of the priorities. We also have a pharmaceutical strategy that was approved also in November 2020, and also the regular health legislation that needs to be put in place. Finally, I would like just one last word, that is also the President von der Leyen said that we can only be safe if everyone in Europe has access to the vaccine, including our neighboring countries and also other countries. So the European Union and the European Commission is making an effort on vaccines and vaccination. And this has paid, because we are nearly achieving the objective of 70% of the population of the European Union with at least 1 dose. And this will allow, we hope, to go back to normal, even if we need to be attentive to the different variants of concern and how the epidemiology of the pandemic is changing, and paying attention to the modifications. So be vigilant, but please vaccinate. Thank you very much.
Thank you very much, Isabel, for sharing with us all the present and future planning. Very ambitious and very reassuring, I think, for healthcare workers and citizens. So we hope that all of those, or part of those, are going to be achieved. Isabel is going to stay with us for some questions at the end of this panel. I would like now to welcome on stage and introduce the next speaker, Laura Borgstedt, Dr. Laura Borgstedt. She's an anesthesiologist and an intensivist based in Munich. I'm very proud to say that she's also an active member of our society, and indeed she's a next member, which is the committee that we have for the young intensivists in the society, and she's part also of the next committee. So welcome, Laura. I think maybe you're on mute, Laura.
I'm sorry, thank you. And thank you very much for your kind words. So first of all, I want to say it's a true honor to be able to talk here and be part of this webinar. I'm just going to share my screen. So, so about the framework for free movement of intensivists in Europe. Well, the ESICM has worked for a long term on the Annex 5, and for many years, ESICM has been working, as I said, on the issue of free movement of intensivists in Europe. So there are a lot of ways to become an intensivist across Europe, and there are a lot of differences in training, but they all lead to the same thing. They lead to highly skilled intensivists. So due to those differences, there's no agreement as to how intensivist qualifications are to be recognized between member states, and thus there's no freedom of movement for intensivists under EU law. So the ESICM has an approach to increase freedom of movement for intensivists. So ESICM proposed a novel approach to inserting intensive care medicine into Annex 5, which includes the principal categories of qualification in this field. And those approaches are a qualification, sub-specialty, where a minimum of 2 years of training in intensive care medicine is required as part of another base specialty, usually anesthesia, cardiology, respiratory medicine, nephrology, or basic internal medicine. Or the other approach is a base specialty for countries where such specialty exists. For example, in Spain, intensive care medicine is a specialty. So the ESICM is inclusive and it recognizes competencies. So as Maurizio said, I'm a young intensivist and I'm here to speak on behalf of young intensivists as a member of the ESICM. So what do young intensivists want? Well, we want to deliver the best possible care to every patient. And how can we achieve this? Well, we need structured clinical training, and also we need research. And in research, it is mandatory, or it is a must to spend some time abroad and to visit someone else's lab and work there. And compared to clinical work, it is fairly easy to go abroad as a researcher. You apply to someone else's lab and they accept you, and then you can spend a couple of years there. But the same person with the same competencies who wants to work in an ICU in a different country has to overcome a lot of bureaucracy to do this. So if you want to pursue a career in science in the medical field, you need to go abroad, need to work internationally, and it's easier than to do this in a clinical context. So we need to have experience. We need to gather experience as intensivists. And how can we do this? From my personal experience, well, I studied abroad. I spent some time in Canada, Switzerland, and France, and I attended a fellowship by ESICM in Italy in 2018. And those were all very valuable experiences, especially the fellowship, where we were 10 intensivists from all over Europe with different backgrounds and different approaches to medicine, and we were talking about the different challenges we're facing, for example, due to multi-drug resistant bacteria, and the different approaches we apply and the different demographics we have in our patients. So those this time abroad, the time I spent abroad, really helped me to get to know different approaches in medicine, to learn different languages, to navigate and work in an environment which was unknown to me. And it really helped me to build a network of colleagues where we can advise ourselves. We can ask, how is it going? What do you do? Do you know this? Have you ever seen this before? Because in a globalized world, we are faced with patients from abroad who are subjected to diseases which we might not know because they're not common in our home country. So, and of course, most recently, the COVID-19 pandemic, where there was a lot of uncertainty and hospitals were faced with a rapidly increasing number of critically ill patients. There was shortage on ICU beds, on ventilators, on medication, on personal protection equipment. And it was really hard to see, among all the other challenges we were facing, the colleagues in distress, because the situation, well, they differ from time to time in the different countries. So when there was a bad outbreak here, somewhere else, the situation was still quite under control, and vice versa. So it was great to see, as an intensivist, the solidarity and the ability to generate ICU beds within hours and days, and the joint effort to take care of the patients, and once again, the solidarity to help each other. I must say the ICU beds, they are important, but they need trained healthcare providers at the bedside to really help the patient. So in order to go towards a Europe-wide or a European intensive care specialist, where every pathway which is already here to become a trained intensive care physician in Europe, there are all those pathways are really valuable, and we all have highly skilled intensivists in every country. But to bring this together, we already have a lot of international programs, like the COBA trees, the competence-based training in intensive care medicine in Europe. We have the EDIC, the European Diploma in Intensive Care Medicine, which is, for example, mandatory in Sweden. We have, as Maurizio said before, the COVID-19 space, although it focuses on healthcare providers not regularly working in the ICU. And we already have the European Union of Medical Specialists with their common training framework. So what I want to say, we young intensivists, we want to be where we are needed the most. And that's what we saw once again during the pandemic. And that's why we need the free movement, because we're all highly skilled and we want to further those skills and share them with others. So yeah, as I said before, we want to be where we are needed the most, especially during times of a pandemic. So with this, I want to say thank you very much, and thank you for this great webinar.
Thank you, Laura, and thank you for sharing with us your insights and your request as a young intensivist. We are nearly coming to the end of this webinar, but we are receiving some questions, and I would like to start with Isabel. Isabel, you've presented a very ambitious program for the Commission, but I have to say, very nice to see this, because in times of crisis, you have to take the opportunity to look at the future. How can a scientific association like ours contribute to this program, or to the delivery and realization of this program? What can we do?
Okay, so we try to involve to all the stakeholders. At this moment, I mean, for the discussion of the regulation, they are still in the Parliament and on the Council, as I said. So there is no role for the scientific association at this moment, even if through the contact with the MEPs, you could also have a role. I mean, encouraging them to approve the areas that you consider that are more important. Regarding the EU for Health, of course that there is a role for the association. I mean, the program basically is based on grants, on tenders, but also on what we call the joint actions with the member state. And there are several activities that are open to the participation of university, research institute, and any kind of NGOs, including the Association of Professionals. There is also an instrument that is the health policy platform, where the different stakeholders can discuss among themselves and also organize discussion fora, webinars, seminars, whatever, for one idea. And there is also specific networks in this health policy platform to follow a thread of discussion. I mean, among themselves. So we count on everybody. And also, I would like to also make a plea, because you know that the Conference for the Future of Europe is going to, I mean, it's already ongoing, but there will be discussions with citizens, individual citizens, and also with associations and etc. There are already for discussion. There is an open website in the EU website. And I will ask you to contribute, because at this moment it seems that health is really not very high in the discussions of this conference for the future of Europe. And we really think that health has to be one of the topics for the future of Europe. So please contribute, please be present. And we need the health professionals, because not only we are, I mean, I'm also a medical doctor. We are an important part of the workforce and of the population, but I think that our views are essential, and sometimes we are not so present as we should be. Thank you.
We accept that, and you can count on us, and we will be supporting you on this with all our means. Laura, just one very final remark. You've shared your story, and you've shared why it's important that we should try to work towards the free movement of intensivists. Is there any first step that you would like to see that we try to realize in a shorter period of time?
Well, I think the most important would be to integrate intensive care medicine in the Annex 5 as a first step. And there's already been a proposal by ESICM in November 2020. So I think that would be the first step.
Which is the annex that defines the medical specialties. And as we said, we've been working with the Commission to find a framework, importantly to remember everyone, that does not change any national training program, but that allows people with similar competencies basically they do the same work to work in each other countries, in each other intensive care unit. I think you're right. I think that should be an important step. We should all work towards that. And Isabel, Laura, I really would like to thank you for your contributions today. And unfortunately, because it was a very enjoyable 1 hour and a half together, it's the time to close this webinar. Istvan cannot be with us for the closure, but I know that he is also very happy on how the conversations have gone. So together with Istvan, we would like to warmly thank everyone and all the participants for the fruitful conversation and for bringing your expertise and commitment towards the European Health Union project and toward a healthier union. I think we discussed about important goals, ambitious goals for the European Union health agenda. And I really believe that we need a stronger cooperation, and we need to open the dialogue more with all policymakers and stakeholders if we really want to take now steps and move from ideas and ambitions to actions to achieve all these goals. I think the challenges of our intensive care community as a fundamental pillar in our healthcare systems are important. And the current crisis has highlighted the strengths, but also the weaknesses that we have to work together in intensive care across Europe. So we believe that these challenges should be taken more seriously, addressed quickly now, and we should prepare more for future cross-border health. This is not going to be the latest pandemic, but it's not just about the pandemic. It's about sharing knowledge. It's about, even in normal times, to learn from each other how we work. And with this, we will have a better way to achieve our ultimate goal, which is treating as best as we can our intensive care patients. And for these reasons, we really would like to request an official hearing in the ENVI committee of the European Parliament of this topic. And I hope that we will succeed and we will have your help, everyone that participated today, in getting this. The long-term objective of raising the standards of care in the European Union can only be achieved by eliminating all the existing bureaucratic barriers for the free movement of intensivists, and by really encouraging exchanges of best practices, skills, and education for our frontline healthcare workers. So we believe that the European Health Union is fundamental to strengthen the EU health security and the framework for this, and really to provide the better healthcare for all the European citizens. And now is the time to act. You can count on our support for these actions. And with this, I would like to thank all the participants, all the speakers for attending this webinar today. Thank you very much.